High blood pressure affects more than 1 billion people worldwide. Hypertension is systolic blood pressure above 140 and diastolic blood pressure over 90, measured in millimeters mercury. Now, what is systolic and diastolic pressure? Well, systolic is where the heart is pumping blood to the organs. Diastolic is the heart filling its ventricles with blood. By the year 2025, nearly 2 billion people will have hypertension. Hypertension affects mostly overweight and elderly individuals. Now, the measurement for arterial blood pressure was first reported by Stephen Hales, an English clergyman and biologist, when in 1733 he anesthetized a horse, tied it down on its side, and inserted a tube to its carotid artery. So basically he inserted a brass tube in the carotid artery, attached it with a flexible tube, a goose's trachea actually, and attached it to a glass tube, and then the blood rose 8 to 9.5 feet above the heart. Treatment of hypertension is relatively recent. In 1931, East and Bain, in their recent advances in cardiology, offered few methods for reducing blood pressure, such as bloodletting and nitrates. In 1944, a man by the name of Walter Kemper suggested a diet approach to treating hypertension, a low-sodium diet. Now, there is no accepted first-line treatment for hypertension. There are many orally active drugs available. All have their advantages and disadvantages to special patients. One classification is by using the first 5 letters of the alphabet, A, B, C, D, and E. So why treat hypertension? Well, if untreated, hypertension can lead to eye problems, stroke, heart failure, myocardial infarction, and renal failure. So let's go over some of the popular hypertensive drugs available. So first we got A. A is for alpha-adrenoreceptor agonists and alpha-adrenoreceptor antagonists. Now there's a difference between the two, which we will find out later. A also stands for ACE inhibitors and angiotensin receptor inhibitors or antagonists. B stands for beta-adrenoreceptor antagonists, mostly known as beta blockers. C is for calcium entry antagonists or calcium channel blockers. D is for diuretics affecting the kidneys, and E is for endothelin antagonists. Before we look more closely at each of these drug classes, please watch the G protein video to understand briefly how the mechanism works, because it's important to know how G protein works to know how the drug works in the body. So we'll begin by looking at the A class. So A is for alpha agonists or alpha adrenoreceptor agonists, which affects the brain mainly. So an example of this is clonidine. And it works and it targets the brain. Now the brain has a place called the vasomotor center, a center which controls vasodilation and vasoconstriction. It sends signals to the heart, the smooth muscles, etc. Now, agonizing or promoting the signals in the alpha receptors of the vasomotor center nerves, specifically the alpha-1 receptors, results in a decrease in calcium ions in the presynaptic cell, resulting in a less adrenaline and noradrenaline being secreted. And this is the difference. Alpha agonists target the presynaptic. Now, all this basically leads to a decrease in cardiac output. Less adrenaline, noradrenaline, decrease in cardiac output. So, alpha-adrenic receptors antagonists work differently. They prevent the function of alpha-1 and alpha-2 receptors. However, not the receptors situated in the brain, but the ones on the postsynaptic cell, not the presynaptic cell. Now, the postsynaptic cells, such as the smooth muscles. An example of this is prazosin, which targets the cardiac alpha-1 receptors. Now, normally, the presynaptic cells, or the sympathetic nerve, is full of noradrenaline, or adrenaline, such as here. Na is noradrenaline. Now, and as an example of the postsynaptic cell, we have smooth muscles. So here we have the postsynaptic cell. So normally, noradrenaline will bind to these receptors on the postsynaptic cell, the alpha 1 or 2 receptors, which work through a G protein diacylglycerol and inositol triphosphate second messenger mechanism, triggering muscle contraction, resulting in an increase in blood pressure. So what alpha antagonists does is that it blocks the binding site of noradrenaline so that noradrenaline does not take effect, no contraction take effect, resulting in lower blood pressure. Now, alpha antagonists also are known to lower low-density lipoproteins and increase high-density lipoproteins. Next, we have ACE inhibitors, and you can remember this because it sounds like the ace of cards. ACE stands for angiotensin converting enzyme. It is situated mostly in the lung's capillary beds, due to its high-density location. Now, ACE produces angiotensin 2. Angiotensin 2 binds to its many receptors distributed around the body, which increases blood pressure by many means. For an example, it can bind to the arterioles, causing vasoconstriction, increasing blood pressure. Angiotensin 2 can also bind to the adrenal gland or the myocytes of the heart, increasing cardiac output, increasing blood pressure. Now, angiotensin 2 is converted by angiotensin 1 by ACE. So angiotensin 1 binds to ACE and gets converted into angiotensin 2. What ACE inhibitors do is that it prevents the conversion of angiotensin 1 to angiotensin 2 by blocking the activation site, like this. The ACE inhibitors usually end in pril. An example of this is captopril. Now, another classification of drugs is called the angiotensin receptor inhibitors. Now, there are typically many angiotensin 2 receptors, but mainly there's the angiotensin 1 receptor and angiotensin 2 receptor, as in AT1 and AT2. Now, it's situated for example, AT1 is situated in the arterioles, and AT1 and AT2 are situated in the myocytes. Now, what these inhibitors do is that they block the receptors of angiotensin 2. Thus, angiotensin 2 has no effect in increasing blood pressure. Angiotensin receptor inhibitors can be known as sartans due to its drug name usually ending in sartan, such as losartan,